Hey guys, what's going on? My name is Remi Sovran, and today I'm going to be talking about lower back pain and lower back issues. So before I get into lower back pain and lower back issues, I'm going to explain my story to you guys that occurred about a year and a half ago, back in November of 2013. So back in November of 2013, I had suffered a serious lower back injury. Now, I was at the gym one day, I was deadlifting, had some heavy weight, and I wasn't deadlifting with good form. The ego kind of got the best of me that day, and I ended up tweaking my back. Now, when I tweaked my back, I didn't think this injury was serious anyway. I just thought it was a muscle strain, some sort of typical injury that commonly occurs. So a few weeks went by where I continued to work out, I continued to play sports such as hockey. Where I was playing hockey at the time, for those of you that know the sport of hockey, the way the mechanics work is that you're always kind of in a forward flexion posture, and therefore that kind of places a lot of stress on your back, especially for someone like myself, who is 6'5", and that's pretty tall for somebody, and I have to bend over a lot further, therefore it places a lot more stress on my lower back. Now, as about 3 weeks went by, this pain in my back never went away, and it actually got more serious. It started to hurt more. And it was a type of pain that I'd never really felt before. It was very excruciating, and it got to the point where I ended up going into the clinic. So I went into the clinic and I met with the nurse practitioner. At the time, the nurse practitioner told me that I had suffered some sort of muscle strain, and she gave me some ibuprofen just to reduce the inflammation. As well as she sent me for some x-rays to make sure there was no fractures or anything, to basically check if there was anything serious going on. So about a week went by, I got my results back. The x-ray didn't show anything, but however, this pain ended up getting worse. I remember I was sitting down, had excruciating pain. I had a pain shooting down my thigh, down my leg. I couldn't even bend over. It was so bad. Couldn't work out like I used to. It was brutal. So I ended up going into the clinic again. This was about a week later, and I met with one of the doctors there. So the doctor basically looked at me and said that I was suffering from the symptom known as sciatica, which is that nerve pain that shoots down your leg. And he didn't really come to any conclusions, but he suggested something like a pure force syndrome occurring. But he ended up sending me for an MRI, and he said we wouldn't know anything until this MRI was conducted, and then he recommended some physical therapy for me. So after this, I ended up going to physical therapy, and then when I went for physical therapy, they didn't know exactly what was going on with me. They thought it could have been anything from a disc issue to something going with my SI joints to some sort of arthritis issue. And so they were doing many different things with me, such as hip stretches, a lot of hip stretches, because I was very tight in my hips just from hockey and sitting down a lot, as well as they did some traction for my spine, which is usually good for a disc injury, and they gave me some mobility drills and core strengthening exercise for me to do. Well, when I was going to physio, it didn't help a lot. I would get relief when I would go there, but however, half an hour later after I left and my session was complete, I would be right back to square one in severe pain. The ibuprofen that I was taking would help a bit. I would pop a couple ibuprofens per day just to reduce the inflammation. That would help reduce the pain. However, also at this time, I had booked an appointment with my family doctor, and the issue was, though, it took me 3 weeks to see him because my family doctor was really busy. He had a lot of patients to see, so it took me a while to get in, and he was away on conference, so there was this whole disaster with his schedule going on. And I finally ended up getting to see him, and he basically suggested that I had an annular tear, which an annular tear, for those of you who don't know, it's some sort of tear on the disc that basically causes that sciatic symptom to occur, and then he ended up putting me on Lyrica in addition to the ibuprofen that I was taking. So Lyrica is a type of medication that helps relax your nerves, but it has a lot of serious side effects as well that can go along with it. However, he told me that this would kind of help me and help my nerve pain, help relax everything. And that he said we won't know anything until I get my MRI done, and kept suggesting that I go to physio. So I continued to go to physio, and also it's important to mention that my MRI wasn't scheduled till March. So this was like 3.5 months later, which was terrible because I wouldn't find out my injury until like 3.5 months later. Now, I ended up getting a bit of a break in January, and the hospital ended up calling saying they had a cancellation, so I was able to get in, got my MRI done, and got the results a few days later, and the results showed a L5-S1 lateral and posterior disc bulge, which was causing irritation on the nerve. And so I went in to the clinic again. I wasn't able to see my family doctor because it was busy again, a lot of things going on. So the doctor I saw at the clinic just basically suggested a lot of rest. He also prescribed me some Tylenol 3, which is an opiate, a painkiller to help relieve the pain. And he just told me to keep doing physio and no serious or hard exercising, no running or anything like that. So I listened to him, I kept doing physio. However, this pain at this time was so excruciating. I mean, I couldn't sleep at night. I'd wake up in the middle of the night, 3 in the morning, and I'd have to pop painkillers just so I could sleep. I remember going to class, sitting in lectures, popping ibuprofens, popping Lyrica, popping painkillers just to sit through an hour and 20-minute lecture during class. I tell you, it was one of the hardest things ever. I'd also come to class with a TENS machine on one of those TENS machines. Those TENS machines just helped relax the nerves a bit. I remember driving to school, it felt like I couldn't drive and I couldn't sit any longer. Sitting was one of the worst things for me. Now, one of the things that I found helped me was just lying on the ground. I would spend most of my days just lying on my stomach. And I think the primary reason why lying on your stomach helped with my posterior disc bulge was because if you think of how gravity works, it's going to pull the disc forward as opposed to posteriorly. So if you look at the mechanics of the body, when someone's bending over, all their discs are protruding posterior, whereas when someone's hyperextending and they're going up like this, the discs are moving forward. So doing a lot of more hyperextension stuff, extension stuff, that was part of my rehab process. So I figured just lying on the ground, lying on my stomach was one of the biggest things that helped me a lot. And that's how I would spend most of my days because it's the only way I would spend a day without pain. And the primary reason why sitting was one of the worst things for me is because if you look at the way the spine works in compression is that when you're sitting, the load increases on your spine. So if you think about it, my disc's already bulging and I'm sitting now, I'm placing more pressure on the disc, so now it's like closing down. It's further going to bulge posteriorly, going to irritate that nerve. And then when I was standing and walking around, I was usually for the most part fine. It's because there was less pressure being placed on the disc, less force. So now I continued to do this for a while, and I was going for physio as well. And I didn't notice a significant improvement until I was done school. I think one of the primary reasons for that is because I didn't have to go to class and sit down. And the other big thing was that my cousin of mine, he recommended an inversion table. And now I'd never tried an inversion table, and the theory behind it is that it creates traction, which is going to create more space between your spine, and so your spinal discs can go back into place because you're creating more room. Now at physio they were doing traction, but however, using an inversion table, the traction was much greater than just someone physically manipulating me themselves, just using different bands and pulling on my legs. So the inversion table was just a huge boost to my recovery. Within about 2 weeks, I was already feeling better. I remember feeling better in about 2 weeks, felt a lot better, and I was able to start exercising a little bit more and doing activities of daily living more without any pain. However, I still had this disc pain, I still had issues bending over, and it was still very problematic for me because I was told it would only take about 6 months to a year for my recovery. So about 6 months had already gone by. Now, I'd gone and saw my family doctor again at this point. I had met with him and told him that this pain isn't going away, and I've seen a little bit of improvement, but it's still bothering me a lot and I can't really do much. So he ended up sending me to some sort of specialist. It was some sort of rehabilitation specialist. And I went and saw this rehabilitation specialist. So when he looked at me, this was probably in June now of 2014, And I had given him all my results. He looked at my MRI, he looked at the disc actually on the computer, and he basically told me that he didn't think that my issue was disc related. He thought something else was going on, something that was related with the joints or bones. So he had sent me for a bone scan at this point. Did a full body bone scan, which specifically he was looking at the fossa. They wanted to look at the fossa joints in my lower lumbar region as well as my sacroiliac joints to see if anything was going on there. So I had the bone scan done and got the results back, met with the specialist again, and they didn't find anything too serious. The only thing that they found was some arthritis in my right hip. But the specialist concluded that my issue was more muscular related than anything, and that he said it's going to take a while to heal, it's going to take a few months, and he gave me a couple sheets of some stretches to do every day for 20 minutes, just do these stretches, specifically hip and glute stretches, and that eventually over time I'd get better. So I did these for about a couple months, and at this time I was still going to physio as well. And the stretching and the stretches helped me a little bit, helped me slightly. I noticed a slight improvement over a few months, but I was still having my issues, and it came to the point where it was in September again, and I was starting school. I was going to be starting school again, and I knew I was going to be sitting in class and that I would have pain again, and it was just a big issue and I didn't want to go through it again. So I met with my family doctor again. So my family doctor sent me for a CAT scan, and he also referred me to a second specialist to see. So we did the CAT scan, did them specifically on my hips, but the CAT scan didn't find anything. And the specialist, it took me about 4 months to see this guy. So I didn't see this guy until December of 2014. Now, by the time December 2014 came around, I was actually feeling a lot better, but I still did have the pain slightly. I did a lot of improvements. The biggest thing for me, I think, was that during this time, in the summer specifically, was that I was doing a lot of my own research online, and I found a lot of good resources. There was a lot of good information out there, specifically a lot of good core exercises, a lot of good mobility drills that would help with a disc injury that I found that helped a lot, specifically ab rollouts, planks, bridges, pale-off presses. All those types of exercises were very helpful in my recovery. So by the time December came around, I'd met with a second specialist, and basically he told me that my issue, looked at my results, he just said it was a disc, and just explained a few things to me, showed me a few exercises. Basically, by the time I saw him, I already knew what to do. It wasn't anything new that he had told me. It was all old information, stuff that I already had learned. Now, I come from a human mechanics background, so I understand the mechanics of the body and how the body moves and how things work. So the specialist did write me a prescription for a lower back brace and also for orthotics, because I have flat feet, and the orthotics, the whole point of them was wearing them would help kind of reduce the compression being placed on my spine. The lumbar brace would just help keep me in a more neutral posture when I'm standing up. So to this day I still wear the orthotics. The lumbar brace I wore for a few weeks, but it just wasn't comfortable and didn't really feel like I needed it. And I had ended up meeting with the specialist one more time in about February, and I met with him though because I had some other issue going on with my back, and something was going on with the left side of my back this time. And it wasn't that disc issue that was going on the right side. Something was going on with my back that it was just, my spine would lock up, different movements and motions would bother it, and I'd get pain. It was almost like some sort of arthritis type of pain. And he basically just told me it was a compensation issue from the disc injury, and the left side was compensating, was putting more stress on it, which is true, but I'm still suffering from pain on that side. And now at this point I can say that my disc issue or my disc injury is, I wouldn't say it's 100% healed, but activities of daily living are fine. I can sit without pain now. My range of motion, specifically in my hips, has improved a lot. I can bend over, a lot of forward flexion. Getting back into exercising, I'm able to deadlift lightweight, squat lightweight, but nothing too serious now. I'm not pushing it. still not 100%, so there's still things I got to do, and I still got to be careful and always be aware of things. So now with that story I just shared with you guys, I want to kind of get into some of my recommendations for you, specifically for people that have disc injury, specifically the L5-S1 region. So my first recommendation to you guys is that you need to push your doctors, push for testing, continuously push for further testing. You want to figure out the problem as soon as possible, so then once you figure the problem out, you can treat it. For me, it took me about 3 months until I knew I had a disc bulge. I'd heard many different things, from a muscle strain to pure force syndrome to an angular tear. I didn't figure it out until I had my MRI. I still wasn't convinced that that was the issue. And then another doctor told me I had some sort of muscle injury going on, so it was a bit of a disaster. Because I was continuously looking at different injuries and how to treat all these different injuries and doing different things. So that's my first recommendation. Continuously push for further testing. So just always kind of be on your doctor's case. I mean, be nice to them. At the end of the day, you're basically paying for them to work. So just be on their case and be persistent with them. Now my second recommendation now is be careful of the medication you're taking, because for myself, I was on 3 different medications at one point. I had the doctors writing me up. I was on ibuprofen, taking about 2 ibuprofens per day. I was taking 2 painkillers, so 2 Tylenol 3s per day, and on top of that I was taking Lyrica. So now when you combine these drugs together, they can produce a data of synergistic effects, and it can make you feel like really drowsy, really tired. And I know with Lyrica, some side effects are pretty serious, such as suicidal, and like a difference in your behavior, changing an aggressive behavior. And I remember feeling that a bit. I was a little bit moody when I was taking Lyrica, and I didn't stay on Lyrica for a long time because I didn't think it was working that much. I stayed on it for maybe a month. I specifically was just taking the ibuprofens and the painkillers. So my recommendation though is that when you're taking a medication, just take it when you need it. For my case, I needed it to sleep because the pain was that bad, and I needed it to take during class. But I mean, if you could like lie on the floor, in my case, without having any pain during the day, and that's going to prevent you from taking medication, then do so. Because taking all that medication is not good for you, so just be careful about that. And just take the medication when you need to, because at the end of the day, the medication isn't healing your injury, it's just treating your symptoms. So that's something to keep in mind. And my third recommendation is physical therapy. Physical therapy, it was very important in my recovery because they were able to teach me some of the basic exercise and mobility drills that I needed to engage in order to heal my injury. Now without them, I wouldn't have learned these things, and it would have been hard for me to discover some of these things online as well. I mean, they showed me different exercises such as kneeling opposites, ab rollouts, different variations of planks, different mobility drills, lots of foam rolling, a lot of tissue work, which really helped with my recovery. So I think doing physio would be, I recommend. Now the one thing with me, I went for about 6 months of physio, and I was going 3 times a week. And by the time 6 months came, my physical therapist basically just told me, he said, listen Remi, we've been treating you for about 6 months. You've been coming here for a while, and there's not much further we can do for you. We've already showed you everything. You already know everything to do. So it's just a matter of rehabbing yourself at home right now. We don't want you to keep coming here and kind of spending $60 per session. And if you want, you can continue to come here. That's your decision. But personally, I would just recommend you come see us when you need to and just do your stuff at home. So I really appreciated it when they practically told me this, because it basically prevented me from spending another $60 per session, and I already knew everything I was able to do. Another thing is that some physical therapists would never say that. They would just continue treating you without even saying anything and just keep taking your money. So for that, I respect them, and they were really important in my treatment as well. So I really thank them for that. And now my fourth recommendation is do a lot of your research online. So do everything you can. Research everything. Find as much research as possible. there's a lot of good information out there, but you gotta look specifically for it. And some of the guys out there I would recommend would be Dr. Stuart McGill. He specifically specializes in lower back pain and lower back issues. So he has a lot of good stuff out there, as well as I like a lot of Eric Cressy and Tony Gentilcore stuff. They have a lot of good core exercise, a lot of good core strengthening, and they really understand how the body works. So a lot of their information is very useful, and I think it could be helpful to anyone out there that has a disc bulge in the lower lumbar region. And my last recommendation for you guys is those that do have a disc injury, specifically in the lower lumbar, is you guys have to manage it appropriately. So just be aware that you have this injury and you can't engage in specific movements or motions. Just always be aware of that, because sometimes you might engage in emotions such as bending over and you don't even realize it, and the next thing you know, you're causing further pain. Just do everything that's going to be helpful to you and avoid anything that's going to cause pain. Just be aware of that, and also know that you will always have a weak spot there. So just be careful of that. So guys, that is my story. That I've shared with you, and I hope you guys have learned something from my story. And I also hope you guys learned something from my 5 recommendations that I've just showed you. Now I'm going to be making a few more videos specifically around lower back pain, specifically a disc bulge, and some exercises that you can engage in to treat it, and some other tips that will help heal your injury. So guys, I hope you guys enjoyed the video, and take care and all the best.